I think it's a very conservative, very independent community, and I think there's a lot of obviously misconceptions about the vaccine. We're trying to get out in front of that, but we do have a lot of people who say, if you're telling me to get it, I'm not doing it. They're just kind of pushing back. So we're going to try to get out one-on-one. We've got to increase the vaccination rate in our community because we're seeing that direct correlation to the increased COVID vaccine or increased COVID activity and a low vaccination number. So we have to get out and change that stat.
And Allison, Chris says that the way to change that stat is not going to be those top-down approaches that you've been seeing in states like the lotteries and things like that, experts coming in. He said it's really going to have to be that face-to-face, one-on-one communication in an area like this to convince folks to get out and get their shots. Allison.
So, Dasha, I have to ask how the hospital staff there is doing. I mean, this is round two, if not three, of the surges they've been seeing. This has been going on for over a year now. They must be exhausted. How are they doing with all those patients?
Yeah, Allison, they are really in the throes of it right now. And imagine this. Imagine you've been doing this, taking care of COVID patients for over a year, and you're seeing the rest of the state, you're seeing much of the rest of the country, your colleagues at other hospitals start to breathe a sigh of relief, seeing hospitalizations go down. Well, you're seeing the opposite of that, hospitalizations going up here. It's heartbreaking to talk to these healthcare workers who have been through so much. I want you to hear from one of them, Dustin Duncan. He is one of the head nurses here. Take a listen to what he had to say.
Picking up extra shifts, staying a little bit longer if necessary, and it's putting a strain on the staff physically and emotionally, especially knowing now that we have a vaccine available and our vaccination rate here in the Valley is as low as it is.
So many of us are starting to see things go back to normal. Folks are taking summer vacations. There is no break for the folks in this building behind me. And Dustin, who has been a nurse for 29 years, told me that over the course of this pandemic, he has had times where he's questioned whether he can really keep doing this. And he's one of an incredibly valued member of this staff. So that just shows how much this is really hitting people, Allison.
Yeah, Dash, you can't blame them with all they have been through. We've said it a million times over the last year, but you can't say it enough how grateful we are for all of our healthcare workers and all that they are doing. Dash, and we are grateful for you and your reporting. Thanks so much, my friend.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.